On Thursday, President Biden signed 8 executive orders relating to the COVID-19 pandemic. I will read to you one of the executive orders as follows. Executive Order on establishing the COVID-19 Pandemic Testing Board and ensuring a sustainable public health workforce for COVID-19 and other biological threats. By the authority vested in me as President by the Constitution and the laws of the United States of America, including Section 301 of Title III United States Code, it is hereby ordered as follows. Section 1. Policy. It is the policy of my administration to control coronavirus disease 2019, COVID-19, by using a government-wide unified approach that includes establishing a national COVID-19 testing and public health workforce strategy, working to expand the supply of tests, working to bring test manufacturing to the United States where possible, working to enhance laboratory testing capacity, working to expand the public health workforce, supporting screening testing for schools and priority populations, and ensuring a clarity of messaging about the use of tests and insurance coverage. Section 2, COVID-19 Pandemic Testing Board. A. Establishment and membership. There is established a COVID-19 Pandemic Testing Board chaired by the coordinator of the COVID-19 response and counselor to the President, COVID-19 response coordinator, or his designee. The testing board shall include representatives from executive departments and agencies that are designated by the President. The heads of agencies so designated shall designate officials from their respective agencies to represent them on the testing board. B. Mission and functions. To support the implementation and oversight of the policy laid out in Section 1 of this order, the testing board shall 1. Coordinate with federal government efforts to promote COVID-19 diagnostic, screening, and surveillance testing. 2. Make recommendations to the President with respect to prioritizing the federal government's assistance to state, local, tribal, and territorial authorities in order to expand testing and reduce disparities in access to testing. 3. Identify barriers to access and use of testing and coordinate federal government efforts to increase testing for A. Priority populations including healthcare workers and other essential workers. B. Communities with major shortages in testing availability and use. C. At-risk settings including long-term care facilities, correctional facilities, immigration custodial settings, detention facilities, schools, child care settings, and food processing and manufacturing facilities. And D. High-risk groups including people experiencing homelessness, migrants, and seasonal workers. 4. Identify methods to expand state, local, tribal, and territorial capacity to conduct testing, contact tracing, and isolation and quarantine in order for schools, businesses, and travel to be conducted safely. 5. Provide guidance on how to enhance the clarity, consistency, and transparency of federal government communication with the public about the goals and purposes of testing. 4. Identify options for the federal government to maximize testing capacity of commercial labs and academic labs. And 7. Oh, that was 6, subsection 6, I accidentally said 4. Subsection 7. Propose short and long-term reforms for the federal government to increase state, local, tribal, and territorial capacity to conduct testing, expand genomic sequencing, and improve the effectiveness and speed of the federal government's response to future pandemics and other biological emergencies. D. The chair of the testing board shall coordinate with the Secretary of Health and Human Services, HHS, and the heads of other relevant agencies or their designees as necessary to ensure that the testing board's work is coordinated with the public health emergency countermeasures enterprise within HHS. Section 3. Actions to address the cost of COVID-19 testing. The Secretary of the Treasury, the Secretary of HHS, and the Secretary of Labor, in coordination with the COVID-19 Response Coordinator, shall promptly and as appropriate and consistent with applicable law, 1. Facilitate the provision of COVID-19 testing free of charge to those who lack comprehensive health insurance, and 2. Clarify group health plans and health insurance issuers' obligations to provide coverage for COVID-19 testing. B. The Secretary of HHS, the Secretary of Education, and the Secretary of Homeland Security, through the Administrator of the Federal Emergency Management Agency, FEMA, in a coordination with the COVID-19 Response Coordinator, shall promptly and as appropriate and consistent with applicable law, 1. Provide support for surveillance tests for settings such as schools, and 2. Expand equitable access to COVID-19 testing. There are further sections of this executive order, however, they go beyond the scope of this video. If you would like to read the rest of the order, the link is in the description below. And just like yesterday, with 8 executive orders, well, 9 yesterday, that was the last one I read, and I am now, again, very tired.